Chair, at this time we'll lay out Senate Bill 11, recognize its author, Chairman Taylor, to explain the bill.
Thank you, Mr. Chairman. After the Santa Fe High School shooting in May of 18 last year, Lieutenant Governor appointed a select committee on violence in schools and school security. None of our members are here today that were on that committee. The committee met 4 times in the summer and heard over 25 hours of testimony. And the result of what we see here is comes from that, and also the Governor Abbott's School Safety Action Plan that was also convened about the same time. Senate Bill 11, this is a draft, members. We're obviously going to be doing a lot of work on this, the first draft. It's an omnibus school safety bill. It's going to encompass a lot of things that have been talked about, and will be talked about in the House and other places, but it has 5 recommendations from the Senate School Safety Report. It also includes 11 recommendations from the Governor's School Safety Action Plan. We add substitute teachers in open enrollment charter schools to the School Safety Code. As you know, 2 substitute teachers died at Santa Fe, and we're not including the training at that point, so we're adding them to this. It includes a multi-hazard emergency operations plan requiring schools to have a file a multi-hazard emergency operations plan with the Texas School Safety Center, which is located in San Marcos. The center will review those plans every 3 years. It also requires that a school district appoint a school safety committee that meets once a semester and provides the Board of Trustees with recommendations regarding the updating of the district's multi-hazard emergency operations plan. The committee will consult with law enforcement on methods to increase law enforcement presence near and on campuses if possible. It will also provide additional mental health training resources and assistance by requiring trauma-informed care training, allowing regional education service centers to work with local mental health authorities as an additional resource for school districts in their region, and will require a district to establish a threat assessment team. So when we have a threat that's given to them, they have somebody who can look at that on their district. It also attempts to add more school counselors to the workforce by authorizing loan repayment assistance for eligible school counselors.
Thank you, Senator Taylor and Senator Lucio, for inviting me to testify on Senate Bill 11. I am speaking on behalf of the Texas Counseling Association and the Texas School Counselor Association, which is a division of TCA. The Texas School Counseling Association represents more than 7,000 professional counselors across Texas, including more than 3,000 school counselors who work in large and small elementary, middle, and high schools in urban, suburban, and rural communities across Texas. I have worked for more than 30 years as a professional school counselor, and I am currently a counselor supervisor. In all of these years, I can honestly say that I have seen a few things, yet the things that I'm seeing today are alarming. Today's students are in crisis. Anxiety and depression are at epidemic proportions. Drug abuse, toxic stress, self-injury, and suicidal ideation are now common concerns, and children are experiencing these problems at younger and younger ages. Over and over, during the meetings of the Senate Select Committee on Violence in Schools, as well as during the governor's stakeholder meetings, teachers, students, parents, and administrators recommended that increasing the time that school counselors spend with students and parents is a critical strategy to create safe schools and increase student success. Senator West acknowledged this morning that mental health issues are a major concern. School counselors agree, and we no longer want to be bogged down with non-counseling tasks while we watch our students suffer. There's much talk about the need to bring in more mental health professionals in our schools, and yes, this is a great step. But are we recognizing the fact that we already have mental health professionals in our schools that do not cost anything additional? Yes, school counselors do academic counseling, especially at the secondary level, but we are not just academic counselors. We are mental health counselors as well. We are trained to do school counseling, that is true, and not therapy. So therefore, we do welcome other mental health professionals in our schools to provide that therapy, to work alongside with us, and to not replace us. Most often an academic meeting with a student starts out with talking about that student's academic needs, but that leads into discovering that that student has bigger issues, more mental health issues that actually block that student from being successful. A school counselor is able to work with, and let me back that up again, a professional school counselor is able to work with the whole student and meet both the academic and the social emotional needs of students. Why not utilize their skills every day to put students back on the right path and to help prevent incidences of school violence? In Texas, school counselors are duly certified as both classroom teachers and school counselors. They have to be classroom teachers first because their job is to teach. They're the ones that teach those guidance lessons and those social, emotional, and character building skills. The Education Code sets forth very specific duties for school counselors that support both school safety and student success. They are incorporated into the Texas Model for Comprehensive School Counseling Programs, which is a resource published by the Texas Counseling Association on behalf of the Texas Education Agency. School counselors strongly believe that if they are able to spend their time teaching social-emotional skills to students starting in pre-K, rather than doing testing, lunch duty, and other clerical work, that we will see a marked decrease in school violence in the years to come. There are two other sections that we would recommend that you reference school counselors. The membership of a threat assessment team in section 37.115 references counselors, but we request that reference to specifically have school counselors added. School counselors are currently charged to work with students and teachers through comprehensive school counseling programs to help them identify and manage threatening behaviors. Specifically referencing school counselors will ensure that the knowledge and training and resources that they bring to a campus will also be available to the threat assessment teams. Under Senate Bill 11, the regional educational service centers will have the opportunity to bring on board non-physician mental health professionals, like licensed professional counselors or licensed clinical social workers, to be available for resources and training for the districts that they serve.
Mr. Hall?
Thank you, Mr. Chairman. You've been in the system for a while.
A long while.
Yeah, right. We won't talk about all that. Tell me, what's your assessment of the uptick that we've had in the mental problems since 2009? That's kind of where it started. What do you think what are the contributing factors to that?
Honestly, I would start with saying that we're not doing the preventive work. We have got to start in our elementary schools. Those elementary counselors are so bogged down with other things, but we have got to get in the classrooms and we've got to teach them the social emotional skills that they need to make good decisions and to make good choices. And I think that's what's happening. As students are more exposed in society to the internet and to other kinds of outside dangers, we have to be more prepared in the schools to deal with that.
That's not quite my question.
Okay.
What caused the uptick in mental problems starting to grow? In 2009, we started to see a growth of it. I'm not talking about what do we need to do about it now, but we have not always had this problem to the extent we have it now. And it is, as you said, it's becoming epidemic.
And I think
So what is it that is the driver that is causing this?
I think it's a society problem. I think it just mirrors what's going on in our society. We're getting away from teaching students skills at home and skills on how to get along and how to handle problems, and the fact that life is going to come with problems. And so I think that is a big contributor. What we're seeing in the schools is that a lot of students have the same problems that we had, in the past, but they're not dealing with it in the correct manners. They don't have the same skills we've had in the past to deal with it.
And they've gone through years and years without going into social emotional learning. We've had years of cognitive teaching where schools were to educate the children, to teach them knowledge-based education. And so we didn't have this social emotional bent that we have today. So
and that is our problem.
What is the change?
And I think that is it. I think that we taught a lot of that in the homes in the past. We taught a lot of that on our social media outlets like TV, things such as that. We don't have that nowadays. Our kids are totally bombarded with just thinking about themselves and not being the kindness aspect to others. they see violence on a daily basis in their video games and then on TV. I think that is the difference. We had a nicer and kinder, as they say, society in the past. We don't have that anymore. And we don't have people that are actually teaching these kids, how to handle the everyday problems. And so a lot of the same things that we handled when we were growing up in the past, these kids don't have the same skills to handle that same problem. So what we hear a lot of is instead, I want to cut myself, or I want to kill myself, I want to hurt myself in some way.
So you're saying that the school now is really assuming the role of the parent?
In a lot of ways, in a lot of situations, yes.
So how much academic time are we giving up to do that?
Well,
Because we're
right
only
now,
so many hours in a day.
and I think that is the problem right now, is though that we are focusing more on the academics than we are focusing, on student mental health. Because what I see is a lot of our resources are going toward helping the students to be successful academically and to pass, our high stakes testing. And we're not, and that's what school counselors are concerned about. We are not utilizing, the skills that they bring to the table to help these kids with the problems that they're experiencing. Does that answer your question?
Yeah.
Sort of.
So, sort of. But tell me, when you do a social emotional assessment and it indicates that there's some additional treatment, help needed, and the parents don't agree, what happens?
Well, what our hope is that we will, as counselors, develop a relationship with those parents that we can gain their trust, and we can show them, how those problems are affecting their students' learning. Every parent wants their child to be successful. And so we're hoping, by going that way, as counselors, that will be instrumental.
No, I understand that. But I'm just saying, you do the assessment and you say, and the parents say, no, I don't agree. What does the school do?
Well, I think that we can still help that student in the sense that we're going to go into the classrooms and still do classroom lessons. There's tiers here, so we can still do the teaching part of it, and that student can still benefit from learning those skills by having a counselor on board, that is actually doing the preventive work, that's actually doing the teaching. Maybe not the individual. Usually when it's that sort of thing, the parents, are not in agreement with the individual counseling.
Okay, does the school go around the parents and maybe call in CPS or get somebody else?
If the student is in danger, of hurting himself or herself, or if we find that this is a severe mental problem, yes, then we go to what we do as counselors is we meet with the assistant principal, our principal, and we do come up with a plan, and then we do call the parent in, and then we will get assistance, of course, from our LSSPs, or maybe even, if we have a social worker on board, we will elicit their help to talk with the parent. Most of the cases I find that when we're talking about, how we can help a student and we're talking about a student's problems, most parents, are pretty on board with that. They're pretty concerned about it. Now, if the student is in danger, right, and the parent, does not respond, yes, we are going to call Children's Protective Services. We are going to report that parent to see if we can do other means. We also get our resource officers involved as well.
In the case we had, a little girl was taken out of her home because her parents had a difference of opinion with the school people. And unfortunately, she was in a state hospital for months. She was restrained. She was injected with drugs. And it took an attorney, a reporter, us, a psychologist, and her doctor to get her home. And that's what we want to avoid as we move forward with these bills.
Glad to hear you say that.
Yes.
It was very clear from earlier testimony that they're actually doing screening, evaluation, making determinations, and going around the parents without permission. And that's not supposed to be, but it's real clear. I mean, when you talk about evidence-based assessments, what's the evidence?
Correct.
It has to come from assessments and screening. And that's going on today in our schools without parental permission.
That's our concern too,
Yes.
and the
It's
push
a
for
very
universal
valid concern.
Yes, and the push for universal mental health screening has been even worse because there's been talk of actually doing that in the school clinic and making the screening instrument part of the intake process. we see it when we go to the doctor. I guess if you're over 50, you end up, you at least have a couple of mental health questions on your intake paperwork, or if you go into a hospital. But nobody talks to you beforehand and says, okay, so if we think that you are suicidal, your care is going to take a completely different trajectory, right? Nobody warns you first. And we worry about that being put onto potential violence and things like that. The best indicator of whether somebody is violent, in my opinion, is the same kind of training that the police get, where you're looking at an immediate risk. Once you get beyond that, you're into situations where you're having to predict the future, and none of us has a crystal ball. That's pretty much the way I see it.
In the issue of mental illness, it's not an exact science. It's and sometimes it's possible that we're confusing confusion in a child with mental illness. The kind of confusion that would come when they don't have good confidence in themselves. That's one of, I think no one will disagree, one of the most important things for a child to have to feel stable is self-confidence. And when we had knowledge-based learning, where a student could learn something, pass a test, actually achieve something, they developed confidence in what they were learning, where they were going. But when we move over to the bent towards social-emotional performance, and there's no right answer, it's all squishy out there. They have nothing to grab onto, nothing to hold on to. And so we're introducing more confusion into the little mind that's already confused from a dysfunctional, slightly functional home life and other life out there. And you couple that with the isolated life that they get by having this to communicate with. This is what they talk to. This is what they get their advice from. Between those three, we've got something that's feeding on itself here, that I feel that we've got a system that exasperates a problem rather than trying to work towards fixing it. And we end up with a confusion there of or an issue where we have a confused mind as opposed to a mentally ill mind.
Yes, sir, we share your concern.